Welcome to Science of Breath. In this course, I'm going to teach you a lot of cool stuff related to our breathing, vitality, core strength, mental health, deeper energetics of the pranayama practice, and how they can aid you on your spiritual journey. I will teach you the bandhas, how to perform them correctly, and why to do them in the first place. We're going to combine chest breathing versus abdominal breath. We're going to go through different kind of pranayama techniques that can help you to calm your nervous system or energize it, make you wake up, or come to a really calm, peaceful state of mind. I teach all the techniques that I teach in my classes, and also I do in my own personal practice. I started yoga and meditation in 2003. I did a teacher training course in 2010. And ever since, I've been having a really consistent and sincere meditation, breathwork, and asana practice. So I dedicate 2 to 3 hours every morning just to meditate and do breathing practices. So it doesn't mean that you have to dedicate that much of time of your morning. However, like everything in life, every skill you want to learn, it requires some dedication. So let's talk about our breathing and how the breath affects our well-being, or in life as general. How life starts. What is the very first thing a newborn baby do before they cry out? They take their first breath. So we arrive into this body with the first inhalation, and until we depart, we continuously breathe. So the breathing literally never stops. Our life is strongly dependent on the breath, because we can go without food for 3 weeks, without water maybe 3 days, but without breath 3 minutes, and life as we know it is in danger. But how often do we actually pay attention to our breath? We just usually take it for granted, not really paying attention where we breathe. However, it determines how we feel and how we perceive life in general. So let's put our breathing into test and do a little assessment and see how you breathe. So this first exercise, I would like you to sit straight, either in a cross-legged position like I do right now, or you could come to a kneeling position, or if you're watching this on a sofa, then please sit up and find a chair where you are not using the back support, but basically you sit upright, you lengthen the spine, relax your shoulders, aligning the pelvic diaphragm with the middle of diaphragm and the torso, so everything is in a straight line. Keep the hands on the knees, just relax them. And then begin to close your eyes and close the mouth. And just pay attention to your breath. Inhale slowly, exhale slowly. And try to feel where the air is traveling to. So you don't need to alter the breath, simply just pay attention to it. Interestingly, when you start observing your breath, it sometimes changes automatically. So if it is the case, then don't worry, just continue. So just act normal without altering your breath in any way. The whole point of the exercise is to detect how you breathe and where you feel your breath. Notice where the air is traveling to. Which area of your torso expanding as you inhale? And which area is contracting as you exhale? That's the only thing you need to pay attention to. Take a couple of more breaths. And slowly open the eyes. So what did you feel? Where did you feel the air was traveling to? Did you feel that it was the belly expanding? Maybe it was the side ribs moving out horizontally? Or maybe it was your chest was becoming bigger? So if you felt that the abdomen was expanding predominantly, then you can give yourself a thumbs up. That's great. If you felt that the side ribs moving out, that's also quite good. But if you felt that you grew a little bit taller and your shoulders rose a bit and your chest expanded, then you have developed the so-called reverse breathing, which means that your body is out of sync from the breath. So why is it called reverse breathing? Because the diaphragm sits here just around the ridges of the ribs. And then as you inhale, the diaphragm should move down and it contracts and flattens out. That will push the belly outwards. And as you exhale, the diaphragm will move up so the belly will come in. So ideally the belly should move, which indicates the diaphragm is moving properly. However, if you breathe into the chest, then the diaphragm doesn't go down, it just remains where it is, and then the belly goes in on the inhale. Because the chest expands, and as you exhale, the belly comes out. So the breath becomes so-called incongruous, it's unnatural. If you follow me across to the next video, I will tell you in great details what are the effects of chest breathing and how to correct it.